I prefer Bon.
Bon. You go by Bon instead of Bonnie. Okay, Bon. All right, Bon. Bonnie is a 26-year-old mother. She injured her back about 2 years ago, which means that she's going to be deep into the maturation phase. It's not really inflammatory or healing anymore. And so to treat this, we're going to use some thermal ultrasound to heat up the deep tissues that we suspect were injured or that are spasming in her back. Some of the general indications for ultrasound can be, or for thermal ultrasound specifically, can be chronic pain, strains, sprains, contusions, muscle spasms, but we only use thermal if it's out of the inflammatory phase. So if it's inflammatory and it's swelling and bruising, we'd probably most likely use non-thermal at a 20% duty cycle. But instead, since we're doing thermal, we're going to use 1 megahertz so that we penetrate deeper into the tissue, muscle tissue of our back. We're going to use, we're going to start at 1.5 intensity watts per centimeter squared with 100% duty cycle for 5 minutes, just because she's new to ultrasound and we don't want to heat her up too much on the first try. So we're going to start light, and then as we continue this treatment in the future, we'll increase that to get more heating effect. Some of the contraindications is if she has an area of impaired pain or temperature sensation, if she has poor circulation, and a big one is that if women are pregnant, we want to avoid using that. So I'm going to explain why we do ultrasound, and I'll ask her about those contraindications. Okay. Hi Bonnie, how's it going?
Good.
Okay, so we already talked about your back pain, and so what we think right now is going to be best treatment is we're going to heat up those tissues. Instead of using a hot pack doesn't go very deep, and we think your problem is going to be a muscle spasm deeper into the tissue. So instead, we're going to use ultrasound. So this ultrasound is I'm gonna do it over that small area that you're experiencing pain in your back, and I'm going to go about 2 to 3 times the size of this little head here. I'm going to stay in that local area, and we're going to heat those tissues really deep in the muscle. Okay.
Okay.
So is that okay with you?
Yeah, sounds fine.
Okay. So in order to do that, I'm going to have to expose your lower back. So is it okay if you pull your shirt up just about halfway, and then pull your shorts down just an inch or 2? Perfect. That's perfect. Okay. So I'm going to put this. Yeah. So I'm gonna apply some gel onto the head of this little applicator here. It's gonna be a little chilly, but I'll put it on your back. But before I do that, I'm gonna set up my machine here. So because we're doing ultrasound and we want to go about 5 minutes, we don't want to go too long since it's our first time. We're gonna go 1 megahertz for deeper penetration, a continuous duty cycle, and we're gonna start at about. Later on, we'll go up to about 2, but we want to keep it lighter right now since it's early on for her. Okay. I'm gonna apply our gel here. Actually, I'm just gonna palpate really quick. So I know this is tender, but I'm just gonna palpate near the area to make sure I'm going to the right area. Is that okay if I place my hands on you? Okay. Those 2. So I know it's tender, so I won't palpate right on the area, but I know that my L5 is gonna be right about here. And we're gonna go on the right side. Okay. Alright, it's gonna be a little bit cold. Okay, perfect. So now we got on here, we'll start it as we move around. Okay, perfect. Do you feel any sensation there? Any heat or hot spots?
Mm-hmm. Well, it's not too hot yet, it's just cold.
Just cold?
Mm-hmm.
Okay.
Yeah.
Okay. So if it starts to heat up or get too hot, you let me know and we'll stop it right away, okay?
Okay.
We definitely want to avoid any burns or any pain. The point is to relieve the pain, not to make more of it.
Good, I'm glad.
So we're going about 2-3 times the size of the effective radiating area of the head of the ultrasound instrument. You feel that heating up at all?
Mm-hmm.
You do?
Yeah.
Oh, wonderful.
Feels good.
Okay. It's been about 5 minutes, so we'll stop our treatment here. Okay, we're off. Okay, perfect. Let's wipe you down a little bit. So you didn't get too hot there or anything?
No.
Okay, awesome. How does your back feel?
Good. Nice
Okay.
and warm.
Fantastic. And your skin looks perfect. Okay.